Greetings, everyone, and welcome to the Haelan Nurse Chronicles podcast. I'm your host, Dr. Lori. For those of you who are just tuning in, I am an author, a nurse scientist, an educator, and a trauma burnout expert. I'm so happy that you're here. Today, we are going to take a deep dive into a critical topic that often goes unnoticed in the healthcare profession: nurse-specific traumatization. As nurses, we are expected to provide optimal care for our patients while also championing well-being and resilience for ourselves and our colleagues. However, there is a significant gap in the resources and the support available for nurses who are experiencing trauma with symptoms that are frequently misattributed to burnout. So today we will explore the AACN's 2021 Essentials, and the AACN is the American Association of Colleges of Nursing, who sets the guidelines for nursing education here in the United States. So it's a very, very important organization. And their essentials lay the groundwork for nursing schools to prepare graduates for contemporary practice with a focus on personal, professional, and leadership development. Well, that all sounds great. We're also going to delve into the AACN's initiative, which is called a competency-based approach to leadership development and resilience for nursing students, which involves 10 nursing schools piloting new content and aimed at enhancing leadership resilience, self-care, and well-being skills among students. Again, it sounds terrific, but we've got some gaps that we need to address, and we're going to talk about those gaps here today. So before we get started, let me just preface our talk in the AACN's trauma-informed care guidelines, which is really germane to nurse-specific traumatization. The AACN themselves say, and I quote, "To help ensure that nurses do not inadvertently become triggers of past trauma for their patients under their care, they should do the following. Assume everyone has experienced some type of trauma in their lives. Realize that we cannot know everyone's trauma history, and understand that the goal isn't necessarily to uncover trauma." Right, so that's their position statement. That's their guidelines, how we as nurses should address trauma in our practices. But here's the gap. Given that nurses are a subset of that everyone who has experienced some type of trauma in their lives, since nurses too have experienced some form of trauma in their lives, shouldn't their employers create working conditions that do not inadvertently become triggers for nurses' past trauma? Now, knowing how important a regulated nervous system is for health and well-being, I was expected to find trauma-informed strategies and practices in the AACN's Nurse Wellbeing and Leadership Toolkit with great enthusiasm, knowing their position on trauma, their guidelines for us regarding trauma, especially given that we as nurses are to assume that every patient has had past trauma, and by inference, then every nurse similarly has had past trauma, not to mention the inordinate amount of avoidable nurse-specific trauma exposure that is secondary to the broken healthcare system or inadequacies in the organization. Now, I know it's a little heavy here today, but it's really important because this is how we are educating the next generation of our nurses, and they are not getting what they need to be resilient in terms of their navigating their nervous system and being prepared, being equipped to deal with the substantial trauma exposure that they will have in their roles. So the concepts that inform these concepts and competencies that nurse educators like myself are to use in the curricula. The concepts that we're going to talk about today and that they're referencing are well-being, that's important, self-care, also important, resilience, yep, and leadership, all important. So with great enthusiasm, I read through each of these concepts, the competencies, the sub-competencies, with these key points in mind from my research and from the research of many other scholars and scientists. All right, so what we know that a regulated nervous system contributes significantly to overall well-being. We know that a regulated nervous system is the foundation upon which all other self-caring practices are optimally built. We know that a regulated nervous system is foundational to resilience. And lastly, we also know that a regulated nervous system is required to effectively practice and lead others. But were any of the essentials, the competencies, were they trauma informed? Not a single one. Now, here's where that big glaring gap is in nursing education and practice. And I certainly don't mean to call out any of my hardworking colleagues. We are all just amazing, doing amazing things. But this is a big gap. This is a big trauma gap. And nurses are among the high-risk professionals that have an inordinate amount of trauma exposure, right up there with military combat personnel, law enforcement, and first responders. So it's like one of my PhD mentors told me to find the gap in the evidence and then drive a Mack truck through it. And that's what I'm doing here today and in my work overall. So if we look at the 10th domain, which has to do with personal and professional leadership and development, we see that, nurses are to contribute to an environment that promotes self-care, personal health, and well-being. And nurses are to evaluate workplace environments to determine the level of health and well-being. Well, as nurses, if we're supposed to demonstrate that commitment, shouldn't the employers then have that same commitment? Like, how can one nurse be committed if the organization, the unit, the system is not supporting that commitment? How can a nurse demonstrate their commitment to personal health and well-being if they're working in unsafe conditions? Sometimes I just don't have words. I just have a facial expression. All right, so let's move to subcompetency 10, 1.c, that states that nurses should contribute to an environment that promotes self-care, personal health, and well-being. And yet, while working, nurses' nervous systems get hijacked at work under the harsh conditions under which most are practicing. And that's where my research and that of many others comes into play. Nurses should first and foremost be safe in their practices, regulated in their nervous systems, so they can then contribute to an environment that promotes self-care, personal health, and well-being. Lastly, let's look at competency 10.1d that states that nurses should evaluate the workplace environment to determine the level of health and well-being. Well, nurses are doing just that. Nurses worldwide are reporting unsafe, unhealthy, unwell practice environments. They're going on strike. They're speaking out on social media. So what is the nurse to do if the organization is unwilling to provide a safe work environment that promotes their health and well-being? So here we are again. Nurses are to demonstrate healthy self-care behaviors that promote wellness and resiliency. But let me be clear, asking nurses to demonstrate self-care behaviors in a dumpster fire of a work environment is beyond unreasonable. Nurses can't, in a 12-hour shift, take their lunch break or meet their basic biological needs. If I were writing the competencies, and they didn't ask me, but if I were writing them, and maybe they will ask me, I don't know, but let's put it out there. Let's put the research out there. Let's put the science out there and see what happens. If I were writing these competencies, they would look like this. They would sound like this. Nurses must be provided with safe, properly staffed, and adequately resourced settings to facilitate their demonstration of self-caring behaviors that promote wellness and resiliencies. Nurses must be provided with safe, properly staffed, and adequately resourced settings that contribute to their ability to promote self-care, personal health, and well-being. Nurses must be provided with safe, properly staffed, and adequately resourced settings and iteratively evaluate them to determine the level of health and well-being. So, are the AACN essentials and competencies unintentionally, implicitly shifting the responsibility for safe, healthy, and well workplaces to the nurses? Yes, nurses need to do their part, of course. But under current conditions, these competencies are like taking a 5 milliliter syringe of saline to a forest fire. Until such time that organizations and healthcare systems prioritize nurse safety and professional well-being, we need to take matters into our own hand. We can't wait for the system to fix itself. We can't have another nurse burn out or experience avoidable nurse-specific traumatization, or have them bounce from the profession altogether. The time is now. We can learn how to insulate ourselves from the unsafe and harsh working conditions. We can learn how to navigate our nervous system as the foundation of all other self-caring practices. We can learn to thrive instead of just survive in our practices. And lastly, we can usher in Nursing 2.0, the Nurse Safety and Professional Wellbeing Edition. To learn more about what you can do to get started on your healing journey, your leadership journey, please join my free webinar. We will drop the link in the show notes. And from there, we will take a deep dive into these topics and more. Thank you so much for tuning in. Until next time, from my healer's heart to yours, thank you for all that you are and all that you do. Namaste.